Anatomy of nose. We will discuss anatomy of nose in detailed manner. I will also tell Ayurveda Sharir of nose by the end of this video. Stay tuned. Take notes and let's get started. Nose is important sense organ. It is an organ of respiratory passage. It is an organ of smell. It consists of two parts. That is external nose and nasal cavity. Both parts divided into two halves. Let's take a look at both parts of nose one by one. External nose. External nose has two elliptical orifices called as nas or nostrils. It is separated from each other by nasal septum or medial wall. Lateral margin of external nose is rounded and mobile. Lateral margin of external nose consists of ala, nasi, cartilage. Structure of external nose is partly bony and partly cartilaginous. Parts of external nose. Bony part consists of nasal bones. Frontal process of maxillae. Nasal part of frontal bone. Cartilaginous part consists of superior and inferior nasal cartilage, septal cartilage, alar cartilage. Blood supply of external nose. Skin of nose supplied by ophthalmic or maxillary arteries. Skin of ala and lower part of septum supplied by facial artery. Nerve supply of external nose. Nose is supplied by ophthalmic and maxillary nerves. You can see root, nasal bone, dorsum, nasal cartilages. Internal structure. Nasal cavity is second part of nose. It consists of four parts: floor, roof, lateral wall, and medial wall. Let's look at each part in detail. Floor. Floor is 5 cm long and 15 cm wide. Floor is formed by palatine process of maxilla and horizontal plate of palatine bone. Floor is slightly higher anteriorly than posterior. Roof. Roof is 7 cm long and 2 mm wide. Middle part of roof is formed by cribriform plate. Anterior slope of roof is formed by nasal part of frontal bone, nasal bone, and nasal cartilage. Posterior slope of roof is formed by inferior surface of sphenoid bone. Lateral wall. Lateral wall marked by nasal concha or metusas. There are three concha, namely superior concha, middle concha, and inferior concha. Space below concha known as metusas. There are three types of metus present below the three types of concha, namely superior metus, middle metus, and inferior metus. In lateral wall, metusas and recess opens in various sinuses and duct. Superior metus opens into posterior ethmoid air sinus. Middle metus opens into maxillary sinus and frontal sinus. Inferior metus opens into nasolacrimal duct. Sphenoethmoidal recess opens into sphenoid sinus. Fourth and last part of nasal cavity is medial wall. Medial wall, also called as nasal septum. Medial wall divides cavity into right and left halves. Medial wall consists of bony and cartilaginous parts. Bony part is formed by vomer and perpendicular plate of ethmoid. Cartilaginous part is formed by septal cartilages. Lower margin of septum is called as columella. Nasal septum or medial wall consists of four borders, namely anterior, posterior, superior, and inferior. Medial wall consists of two surfaces, namely right and left. Given diagram is a formation of nasal septum. Blood supply to nasal septum is shown in the figure. Nerve supply of nasal septum. Now take a look at paranasal sinuses. Paranasal sinuses are cavities found inferior to bones. Sinuses are air-filled sacs. There are four types of sinuses: frontal, maxillary, sphenoid, and ethmoid. All paranasal sinuses opens into nasal cavity through lateral wall. Functions of paranasal sinuses. Sinuses resonates voice. Skull weight reduces due to sinuses. Sinuses warm and moisten inhaled air. Sinuses also act as shock absorber. Now take a look at each sinus in detail. First is frontal sinus. It is rarely symmetrical. Frontal sinus contained within frontal bone. It is roughly triangular. Frontal sinus opens into middle meatus. Maxillary sinus. It is paired and symmetrical. Maxillary sinus located within body of maxilla. It opens into middle meatus. Sphenoid sinus. It lies within body of sphenoid bone. Sphenoid sinus opens into sphenoethmoid recess. It is extended between dorsum sellae and posterior clinoid process. Ethmoid sinus. There are three types of ethmoid sinuses: anterior, posterior, and middle. Anterior and middle ethmoid sinus opens into middle meatus. Posterior ethmoid sinus opens into superior meatus. Blood supply. Blood is supplied to nasal cavity by ethmoid artery, facial artery, sphenopalatine artery, and palatine artery. Nerve supply. Nerve supply to nasal cavity is general sensory through the branches of trigeminal nerve, and special sensory through the branches of olfactory nerve. Arteries supplying lateral wall of cavity is shown in the figure. Nerve supply of lateral wall of nasal cavity. Lymphatic drainage. Lymph nodes present in nasal cavity are submandibular nodes and cervical nodes. Now take a look at applied anatomy. Common cold. Common cold or rhinitis is the commonest infection of the nose. It may be infective or allergic or both. It commonly occurs during change of seasons. Congenital nose deformities. It includes congenital weakness in the structure of the nose. Epistaxis. Epistaxis is called as bleeding from nose. Sphenopalatine artery is the artery of epistaxis. Little's area on the septum is a common site of bleeding from the nose. Deviation of the nasal septum. Pathological deviation of the nasal septum is often responsible for repeated attacks of common cold, allergic rhinitis, sinusitis. In these conditions it requires surgical correction. Deviated nasal septum. Now let's take a look at Ayurveda Sharir of nose. Ayurveda Sharir of nose is called as Nasa Sharir. Sense organs called as Indriya. Nose is a sense organ. So Nasa as Indriya. Indriyarth of nose is Gandha. Nose is made up of Prithvi Mahabhut. Measurement in Ayurveda is done by Praman. Nasa is of 4 angul. Nasa Pud is of 2 angul. Nasa Pud Maryada is of 1 angul. Nose consists of 2 peshi, 2 dhamani, and 24 sira. Phanamam is present at nose. Panchakam is done by Nasya. Nose possess Vata and Kapha dosh in greater quantity. Mal of Nasa is Mansdhatu and Khamal.